My name is Boulanger. I'm the Executive Vice President and Chief Operating Officer of Baptist Health, South Florida.
And what is your new
My new position entails operational responsibility for all 10 of our acute care hospitals and 50 some odd outpatient facilities all the way from the Middle Keys up into Palm Beach County. In Weston, my dad was a medic in World War II in the Battle of the Bulge and a bunch of other things, and came back and was encouraged by a surgeon friend of his to become a hospital administrator, and the career was just starting. So I grew up in hospitals, and we moved around the country, and we're in different hospitals, and I grew to love the interactions with physicians and hospitals and how fascinating they were from a young man. And this is all I've ever wanted to do, and I couldn't be happier doing it. Well, I went to undergraduate at University of Florida, got a business degree, Master's in Science and Business Administration. Went to Washington University. It's actually part of the School of Medicine, the Hospital Administration program, which is also where my dad went because I wanted those contacts out in the industry. And I came back down here to Miami. I grew up in Tampa, but I came back down here to Miami, and I was an administrative resident at South Miami Hospital 33 years ago. And I started a couple of outpatient businesses for them and got hired by South Miami and given a variety of operational responsibilities. I moved on to Homestead Hospital after we acquired Homestead Hospital from the city of Homestead. I was a vice president of operations there. I became the CEO of Homestead Hospital a year after Hurricane Andrew. I did that for a number of years, and then I came up to Baptist Hospital of Miami, and I most recently have been the CEO of Baptist Hospital of Miami since 2006, and I've been in this position for about 3 months. Well, fortunately, I've spent my entire adult career here, so I know Baptist extremely well, and I've had the benefit now of being senior leader in 3 of the hospitals. So it hasn't been much of a learning curve to learn the structure or the culture of Baptist Health that's really ingrained in me. What has been very interesting for me is to learn the culture down at Marathon in Florida Keys at Fisherman's Hospital and at Bethesda Health, our 2 hospitals up there and our outpatient centers in Broward and Palm Beach County. Just trying to be myself, and that was the advice given to me by a very wise board member. So they gave you the job because of who you are, and be yourself. So throughout my career, I've tried to just be practical and direct and forthright, and to try to keep things simple, but also to use data and to manage based upon data. I wouldn't say there's been much of a learning curve in terms of the new job. I'm still excited about all my opportunities to learn and grow in this new position, but I do know Baptist Health pretty well. And what I think I can learn is how to take my experiences as a hospital or an outpatient operator and help the other hospitals merge with us culturally and continue to support the great hospital CEOs and staff that we've got and doctors that we have, and to grow the centers of excellence that we've got. And that and expanding our geographic footprint is really some of the immediate priorities for us. The biggest challenge to Baptist Health is the rate in which the industry is changing. There's a merger and acquisitions locomotive that's going on right now that is really as a result of a lot of the payment reforms that has occurred in the last 4 to 5 years. And so we've got to respond to that. We've got to keep up to that. We've also got to be relevant with people, with consumers. So we've got to accelerate our adoption of technology. You know, like we have a CareVenience app, we have a Care on Demand app. We're working on being even more convenient and accessible to patients through whatever way they want to access us, through their phone, through their computer, through very convenient outpatient locations. While we build these centers of excellence, which are some of the best in the country, that people want to come to internationally and, you know, throughout the state of Florida. So, you know, those are our goals. In certain of our facilities, they're completely full because the Baptist brand is so strong, and I see modest growth in some of our facilities, but I see the majority of our growth in the technology space, in the outpatient space, and then in our centers of excellence. You know, for example, we just spent $400 million on the new Miami Cancer Institute. Have you seen it yet?
I haven't.
It's unbelievable. and it is like nothing else in the world. We are the only place with every radiotherapy platform in North America, including the only proton unit south of Jacksonville. And it's a warm, welcoming place, but amazing technology. You feel like you're on the bridge of the Enterprise, you know, when you're in this facility. And we just invested, so that's people. They recruited 34 surgeons from around, or doctors from around the world to treat cancer from some of the most preeminent institutions. And we worked out a Memorial Sloan Kettering alliance, so we bring the very latest drug trials to Miami so people don't have to leave Miami for the very latest drug trials. So we do that kind of thing in cancer care, and in the heart and vascular space we've done that at the Miami Cardiac and Vascular Institute. So I see us becoming more and more national and world leaders in certain centers of excellence like orthopedics and sports medicine. I just had a doctor friend text me last night a photo of him. He got a bilateral knee replacement yesterday, and he was up walking last night. And he was like, "This is amazing. I never would have thought this could happen." So, you know, things like that we want to bring to people in the community, that's what we're going to be working on. That's where I see the growth. We used a balanced scorecard approach, so patient satisfaction is really one of the most important things. Our quality metrics, how our people feel, the employee engagement, which we're blessed to have some of the highest employee engagement, you know, in the country, and Fortune 100 best places to work 18 times in a row. Our physician engagement is the highest in the database, so culture and people engagement and turnover rate, satisfaction of clinical people. Then, of course, the financial metrics, you know, no margin, no mission. We've got to continue to be able to be here and provide for the community. And growth. We've got to grow and innovate. And if we're not excelling in all of those realms, you know, we're not doing our jobs.